you suspect AADC deficiency if patient presents with hypotonia, delayed motor development, oculogyric crisis, or any other type of dystonia, or if they have any autonomic symptoms. So if you have this constellation of symptoms, then you suspect AADC deficiency. And various physicians can be involved with this because of the movement disorder. Many times the movement disorder specialists see these patients, or even geneticists. Sometimes these kids are referred to the geneticist to make sure there is no underlying genetic issues. Obviously, the child neurologists are involved as well. Sometimes even rehab physician, because these kids are diagnosed with cerebral palsy, so they go and see the rehab physicians. So these are the various specialists which can be involved with this disorder. When it comes to diagnosing this disorder, there are various ways you can diagnose it. The most easy way to do the genetic testing. And you can do genetic testing through the blood, where you can look for the mutation in the DDC gene. But when to suspect, obviously we are not going to do the genetic testing right away. So a lot of time, these kids have different workup, and some of the workup can include looking for blood for 3-O-methyl dopa, 3-OMD level, or they can have, you can check urine organic acid for increased urinary VLA, vanillyl lactic acid. They can also have CSF neurotransmitters checked. And in that one, so that's a panel. It's a CSF neurotransmitter metabolic panel where you are looking for reduced homovanillic acid, HVA, and elevated 3-O-methyl dopa or 5-hydroxytryptophan. But they also have normal pterin in the CSF. So if you check the neurotransmitter, you might have diagnosis from there, or you can check plasma enzyme activity as well. So you can do the enzyme activity assay, and you can check for AADC deficiency or AADC enzyme. So, but typically the consensus is once you are suspecting through these labs, better is to confirm through the genetic testing by looking for mutation in DDC gene. Most important point is these kids present very early at around like 2 to 3 months of age, or some of them even have presented during neonatal period. But it's misdiagnosed or not diagnosed until very late age, around 2 to 3 years of age. So my recommendation would be, if you have those constellation of symptoms, then consider checking for it as soon as possible, because you can make changes in their management overall, especially if the new emerging therapy coming up. It will be very important to diagnose them as soon as possible so that their long-term complications can be prevented. Say that if you have patient with hypotonia or delayed motor development, and the MRI is inconsistent with clinical symptoms, or if they have some kind of movement disorder, for example, dystonia, hypokinesia, or I think one of the pathognomonic, I would say, is oculogyric crisis, though it can be seen in other conditions, but actually it's very characteristic for this condition. Or if they have autonomic symptoms, for example, temperature instability, ptosis, then they should suspect this disorder and consider checking for this disorder.